appreciate you for doing this. I read an article in the, I actually had to go back to it this morning because it's been so long since we scheduled it, but in the Texas Tribune. And are you with a nonprofit or an organization that you're representing?
So I actually just accepted a position that's national. I'm strategic advisor for funders for birth justice and equity. I can put that in the chat.
Okay. That's cool. I'll link it in the show notes.
But I also, a lot of the work that I've been doing locally has been with the Maternal Health Equity Collaborative.
Okay.
As a community advocate.
Is that organization a Texas-based organization, or is that?
Yes.
Okay. And for people that don't know, and it was shocking for me to learn that African American women are more susceptible to birth injury or even dying while giving birth. And I didn't know that. So can you share a little bit about that and some data behind that?
Sure. Oh, are we going?
Oh, we're going. Yeah, we're going. Yeah.
Okay. Just like men taking pictures, you got to count down.
3, 2. Well, I feel, I used to do that, and I feel like it creates like a little tension. You know what I mean? Like everyone's kind of like upright. I feel like if you just like start the conversation naturally, then it kind of just progresses. You know what I mean? But yeah.
No, it's all good. Either way, it's all good.
Okay.
So yeah, actually in the United States as a whole, you see a disparity in birth outcomes for Black women. It can be nationally, it's almost 3 times as likely that a Black woman dies from pregnancy-related causes. But even if you drill down further, for instance, for New York City, it's 12 times as likely. In different parts of Texas, it looks different, but it's 2 to 3 times as likely in the state of Texas. Similarly, we have higher rates of infant mortality as well as premature babies. So across the board, we see lots of disparities, and that's irregardless of income. There's actually an article that came out recently from the New York Times that is a really comprehensive study over several years out of California that showed even the wealthiest Black women still have worse outcomes than the poorest white women in California. So that's very poignant.
Yeah, no, that's mind-boggling. Is there a number one factor that's can be correlated with all these, or is it kind of a little bit of everything?
I think that there are multiple factors, but the one that I think people are still having challenges wrapping their mind or their heads around is systemic racism. And I think I say systemic racism. I think interpersonal racism, exists at a micro level. But when you think about the building of a structure and think of our country as a structure, within it, there are systems. And the majority of those systems, when they were built in a time where the access and the support did not exist for Black people. As an example, the financial institution or the criminal justice institution, and that also exists within healthcare, right? And so you have systems that have existed for over 100 years that were instituted in a time when Black people weren't even considered to be fully human, right? And then it kind of progressed to separate but not equal. You had your own hospitals, or you couldn't birth in the hospital. And now to the current place that we're at, where we're trying to course correct, but we haven't, in many cases, gone back to address the system and the foundation of the healthcare system.
Can you define for me, because I'm ignorant, can you define what systemic racism is?
Sure. So, and you're not ignorant, by the way.
Well, there's multiple definitions, and depending which article you read, who you're talking to, everyone has a different definition. So I didn't know if there's like a global agreed definition.
Um, is there for anything? I
I
don't
don't
think
know.
so.
Yeah.
But I would say what I would share is that systemic racism is racism that exists within systems. So that would look like policies and um, practices, right, that exclude or include certain populations of people, and marginalized people are negatively impacted. That would be because of their race,
Mm.
right? Um, that would be a definition of systemic racism. And then when you go to interpersonal racism, that's where people kind of get stuck of, I'm not racist, I love everybody and I have friends and family and all of that. But even at that level, we have all kinds of prejudices and biases. But the difference between a prejudice and a bias and it kind of spilling over into racism is that it's specific to race, and the person that is imposing the racist behavior has power and resources, right? So not only do I think something negatively about you or, act some way that's harmful to you, but I have more power to injure you. Does that make
No,
sense?
that's a great definition. So systemic racism and in healthcare specifically, so that's kind of what we're talking about. Does that
Mhm.
mean no matter who's taking care of the person or who's providing the healthcare, no matter what kind of person that they are, uh, the negative effects of systemic racism still exist?
Yes.
Okay.
And that's a really good question, but we also know statistically that when a white provider um, is caring for a Black patient, whether it be the mom or the baby, there's a higher rate of mortality.
Mm.
And the first time I heard that statistic, I was like, that cannot be true in the 21st century. Like, why is that a thing? Um, but it is absolutely proven by data. And uh, yeah.
What are the demographics in Texas? Last I checked, I think there and I think it was 40% white people, 40% Hispanic, and then 11% or 12%. Is that still accurate of African Americans? That's
That's
still
pretty
about.
accurate. Although we're actually seeing a decrease in people that identify as white. But yeah, there's actually seeing a decline in the white population and an increase in the Latinx population. And then for the Black population, it's staying pretty steady. But if you go to cities like Austin, where I live, there's actually a decline, an overall increase in the population in Austin and for every demographic but Black people. And we're actually seeing a decline. We're the only major city in the country that has an increasing population and a decreasing Black population. We're at 6% and dropping
Hmm.
currently.
What do you think the reason is?
There's a lot of reasons. I actually am a part of an organization that it's called the African American Leadership Institute. And we worked with a nonprofit in town called Measure and did a study of over 300 Black people who lived in Austin, and asked what was the reason why people leave. And the top reason was affordability,
Hmm.
but just behind it was lack of belonging. And right under that was racism. And
Wow.
when you talk native Austinites, and a lot of people don't know this, but when Austin was first settled in for, many years after the settlement of the city, Black people were actually the majority in Austin. Um, Upwards of 50 to 60% of the population were native Austinites that were Black or indigenous. And to go from that to less than 6%
Yeah.
is mind blowing.
Yeah. So I'm from Dripping Springs originally.
Okay, okay.
I live near Houston right now, And same thing. A lot of my family members, a lot of my friends that were native Dripping Springs, Austin, they all left or they are leaving because of the affordability. But I didn't know
Mhm.
racism was one. I feel like there's a barrier that exists between the Hispanic and African American community. And our view on racism is just completely different. Um, I guess we just
Yeah,
experience different things historically, and
absolutely.
even in current, what happens currently today. I feel like, and I'm definitely not like a voice for like the Hispanic people, but I feel like the Hispanic population by and large gets left out of race talks or when it comes to diversity and inclusion programs. It's like the white people and the black people, and then the Hispanics get kind of left out. Do you kind of see the same thing?
I think that's an interesting point to make. I think, the history of this country in particular, I think when you kind of pan out to our more global view, that the conversation shifts. But when you think about like the history of this country, um, slavery is so embedded into like the building of this country. And that was, Native Africans and white people.
Mm,
That's where, and a lot of the systemic and structural racism originally was, Black people were the most impacted. I think when you kind of come zero in, especially on states that have borders, international borders, specifically either to the Caribbean and or to Mexico. And Texas, the majority of Texas used to be Mexico. That's
right.
that's a whole other thing.
Yeah.
That it looks different, right? Or California. I absolutely agree that we are both facing some hard things, but they just look a little bit different. I actually am biracial. I'm Black and Mexican.
Okay.
Um,
Yay.
and, you know, and not because of my nationality or ethnic background, but I'm very passionate just about social justice for anybody so that we all have the same life, liberty, and pursuit of happiness. And I think the reality of the situation is that we have a country that's built on white supremacy. And so you have every other population, marginalized population, that is kind of seeing some inequities. And sometimes I think maybe we get into a little bit of a competition of who has it worst. When the reality is we just need to like focus on the structure so that we can all have it
Yeah.
better, right? Yeah.
No, I fully agree. Do, you know, the history of racism is still alive and well, and um, but do you think we'll get to a point where we don't, like, it's not a thing and we have to talk about it? Like the generation of kids today, like my kids are biracial. My wife is white and Hispanic, and I'm Hispanic, and I'm wondering if 20 years from now, if they happen to look more white, if that's if they'll be classified as a certain type of person just because they're fair skinned,
Mm-hmm.
or what the future will look like. Like, do you ever see us getting to a point where like we'd never have to talk about racism? Like a perfect example is I was watching the Super Bowl, or the game was on this weekend, and the reporter was asking the football analyst was saying, "Hey, this is a historic time because both QBs are African American." And so what do you think about that? And the coach that they were asking was actually African American, and he was like, "Can we not classify them as African American and just classify them as human beings and as two great QBs?" I'm wondering when we like transition to that. Do you think that's ever a possibility?
Right. Well, I think that there's a lot that has to shift, and I agree with both points of view, right? Um, even when we think about history in this country, and we have African American history, and we have Black. We're in February right now. We have Black History Month, right? And you're like, well, why is it separate? And it's because it has not been included in the totality of American history, right? And in all of these different industries and sectors, there have been barriers, whether it's, it was 1990s and the 2000s before we had Black people winning Grammys and Oscars for the first time, right?
Mm,
So we got to get past some of these first.
yeah.
And we should definitely be seen for what we bring and, who we are, and not just for our race. But it is also important for people to acknowledge the fact that for so long there has been a lack of opportunity and access, right? And to celebrate moving forward. And I think, to your point at the beginning of the conversation, you were like, I didn't know that, Black women were dying at disproportionate rates. Like, if we don't talk about it, then
Mm,
how can we heal from it, right? So I think it's kind of like, you have kids, I have kids. Like, some people take the approach, sex is a dirty little word. We don't talk about sex, and we definitely don't talk about sex in front of our kids. But then you have them go to school and other places out in the world and get misinformation that can harm them. And so I think, as a community and a global community, like, if we continue to like kind of stifle those conversations and don't own it and meet each other where we are, then we will continue to harm each other. So we're not there yet. I'm not, I can't see into the future, so I don't know that we will ever get there.
mm.
However, I'm hopeful, and I try to do my part to move us in the right direction, but I don't shy away from those hard conversations either.
Yeah, no, and these conversations are definitely needed. While you were talking, I was curious about the demographics in hospitals. What's the racial makeup of these delivery nurses in hospitals? Are they mostly white nurses, or is it?
I would say, obviously, that can still vary regionally, but uh, in a more general way, it is mostly white women. We see that in the nursing profession, and we also see that in education. And so that is another research proven way to improve outcomes, is to increase the number of healthcare professionals, the workforce pipeline that are, treating patients. So I'm hoping that we get to a day where, we don't have to I don't have to have a Black doctor to know that I'm going to get the best care.
Right. I love talking about diversity and inclusion, Nakeenya. I work in a corporate environment, and sometimes I feel like it comes off as too much, especially if it's coming from a white person. Like, I feel like they're trying to make up, like they're trying too hard. You know what I mean? It
Mm-hmm.
doesn't come across as being sincere. And one of the conversations that we had was that the makeup of our company and our team, and we needed to make it more diverse. Um, and we were trying to actively do that, but the makeup of our community is just that. Like, there's more white people, there's more Hispanics, and then there are African Americans or even Asian Americans. So it's tough, like, to balance what a balanced team would look like having a true diverse team. I don't know what that would really look like. I don't know what the answer is, because there's just more Mexicans and white people right now.
Right. And so I think, there are a couple of ways to look at this. There is, reflecting the community that you serve, but there's also reflecting a larger community of diverse perspectives.
Mm.
What we know, and I think, specifically in the state of Texas, we actually just had some news headlines last week from our governor around no longer using diversity, equity, inclusion in state hiring. But part of the reason why diversity, equity, inclusion is important is because we know that diverse perspectives allows for more innovation.
Yeah.
Right. If I'm in a room trying to solve for any given problem or to come up with a new product or solution, if I'm in a room full of all men, there's going to be a limit to, how we innovate. And it's the same thing when you think about if everyone in the room is from the same socioeconomic backgrounds, same ethnic background, then we limit the possibilities of what we can solve for. And we also stifle the opportunities to be in genuine relationship with people who have different life experiences from us.
If the Hispanic culture, the older generation, they're typically not healthy. There's a lot of health, it's very nuanced. There's like food deserts and access to better healthcare, but access to better food, organic food, stuff like that. Does some of that play a role in these birth related deaths in hospitals for African American women? Is it all at the hospital, or is there work that can be done before the women get to the hospital?
Sure. So yes, and I'm so glad that you asked that. One of my roles is as the community advocate position on the Texas Maternal Mortality and Morbidity Review Committee. Big word. Basically, we review all of the pregnancy related deaths within the state of Texas. And we just released our report in December. And one of the things that we see in terms of our recommendations is I lost my train of thought.
You're
Sorry,
good.
there was
No,
a message.
you're good.
What were we talking about?
You're talking about the health of the women. A new study was
Yes, yes.
released. Yeah.
So we see that in terms of the recommendations that the committee makes based on reviewing these deaths, is that um, there's the providers recommendations. We see lots of facility recommendations, and then we also see community-based recommendations. So that could also improve like nonprofits or whatever. So yes, and what you're kind of leaning towards in terms of factors that go into it are social determinants of health, right? Access to clean and clean water, healthy foods, being able to be physically active. There's so many different factors, and we know that historically, and this is where it expands beyond just the Black community. I would say to the Latinx community, in some cases, rural communities, and those who are low socioeconomic backgrounds. You have all of these factors that put them at higher risk for disease and that compromise their health, so that once you get to the point of childbearing age, you're actually at a higher risk. And I think some people want to boil it down to and say, oh, well, you shouldn't eat this, or you shouldn't eat that, or, if you exercised more. But what we know is that people live in food deserts, right? Where there is no grocery store and very little, if any access to, fresh produce and fresh food. People live in places where there are no sidewalks and there are no parks and gyms. And some of that also is historical and systemic racism, right? The ways that cities and governments have funded and or corporations value, where they put their businesses.
Yeah.
So yes, but it's not as simple as, well, those people, they need to eat better.
Yeah. No, it's not because well, the access to processed food and the cost of it is just so cheap and it's easily attainable. So if I'm, if I'm hurting for money and I have kids to feed, why not get, the box of food and the frozen processed food that's just a lot cheaper? Or even there's a freaking McDonald's at every corner, every street corner now, or a Sonic or a Taco Bell now. So those access to, those types of foods are I think that's the problem. It's just the
Mhm.
type of food that's cheap and anyone can get their hands on now.
Yeah, I mean, when you think about it, in every um, culture around the world, one of the cheapest things to consume is rice and beans.
Mm.
And you see that, whether it's, in different parts of Asia, Central and South America, North America, rice and beans. But that is not everything in moderation, right? Um, and when you specifically look at the United States, other parts of the world, there's still more agriculture and farming and more access. But we're so processed and we're so commercialized, and we live in a very capitalist society here in the United States where, people don't grow, their fruits and vegetables. Although we're starting to see a little bit of interest in that, but especially now that eggs are so expensive, everyone wants to get some chickens. But we've gotten away from that, and we go with quick, fast, and convenient, and whatever is the right price point. And we don't have local markets, and people aren't walking to go get fresh fruits and vegetables daily, and it makes a difference. People eat what they can afford, and they eat what they have access to.
So are the organizations that you work with, are y'all helping address some of that food availability and resources for the underprivileged communities?
I What we usually do well is partner. There's so many things that need to be addressed, and a lot of times organizations like the ones that I work with are usually the most underfunded.
Mm.
Black-led organizations typically do more work with less money. And so, we're stretched thin just to focus on, one particular area. Um, so what we do best is we try to collaborate and partner with other, whether it's hospitals or city and government entities, or other nonprofits that are maybe working with the unhoused, or working in with environmental justice, to look at the intersections and to work to improve. One example of that, I don't know if you remember, but last year for several months, we had a food shortage.
Yeah. Yeah.
I'm sorry, a formula shortage.
Yep.
And it was awful. And it was actually worse in Texas and other parts of the country. And I, because I work in the maternal health realm, I kind of had my ear to the ground, and we were talking to women who didn't have access. And what we were seeing, especially in our Black and Brown communities, is that moms were resorting to giving, rice milk or carnation, whatever they were, in desperate need of a way to feed their babies.
Right.
And so that was not, something that the organizations I work with, usually focused on. But it was a need of the community at that time. And so we pulled in other people that could help us. The in Austin, the mayor was able to work with a vendor out of New York and like purchase in bulk a bunch of formula that came to Austin. And then he worked with key nonprofits that had the best connections to community to distribute. So I think that's an example of, how we get it done.
Yeah.
And it isn't always, our primary role, but we may be a catalyst or a linchpin.
No, no, that's a great example. What's the perception of the workers in the hospital when they're presented with the data about African American women dying at a higher rate than other races?
You said what is like, how is it received?
Yeah, like what I mean, do they push back at all? Or are they willing to help your team and y'all's efforts? Is it a collaborative effort? If it's kind of a push, like what does that relationship look like?
I think that nobody goes into a helping profession. And I would say helping professions ranging from social work to healthcare, wanting to do harm. In fact, it's against the Hippocratic oath. But I think whether it's, the systems and how people are trained, right? The education that they receive, and just the unconscious biases that we have, you know, it's a reality. And so I think that some organizations, some, medical institutions are further along than others. And so they're working with and alongside of us. And there are other organizations that are, still, trying to kind of figure it out. It's a hard thing to work through, right? When you're there to help people and then you see that there are people that are being harmed
Yeah.
because of who they are innately.
No, that's got to be a tough situation. I Is there actual legislation being proposed to do anything about this? I think I recall there's like a series of bills, right?
Yeah, so Representative Sean Theory out of Houston, actually,
Okay.
she has been at the forefront of advocating for a lot of legislation around maternal health and maternal health equity. And she actually just in the last week filed a momnibus, which is a series of bills that are grouped together that are all related to maternal health. And one of them is to implement um, training on unbiased and unconscious bias training, unconscious bias training into both existing institutions where people are already doctors, nurses, but also into like nursing schools and medical schools. So that legislation is actually on the table along with several other bills that I think are going to help.
Okay. Are they being supported across both sides of the aisle?
So it's too early to tell. She just filed her omnibus. It has the Speaker of the House has not yet identified his priorities yet. Although we know that another priority related to maternal health is to extend Medicaid coverage to 12 months postpartum, and he has already said that that is a priority for this legislative session, and that impacts Black women. 70% of Black women in the state of Texas use pregnancy Medicaid, but not just them exclusively. A large majority of women who are pregnant in Texas across ethnic backgrounds use Medicaid during pregnancy. So that's another one that I think we will see get a lot of attention over the next couple of months. And tentatively, there seems to be a lot of support in the House and the Senate, and bipartisan support. So I'm hopeful that that will remain the case, and that we'll see some good policy to help improve, some of our outcomes.
There's an element of just medical costs too, right? Like it's just the sheer amount of money it takes to get seen by a doctor. If you don't have insurance, or if you're even if you're on Medicaid, I imagine. Well, also even if you have insurance, like I have insurance, and it seems like it costs a lot of money to go see the doctor. Um, is there anything being addressed about that?
I'm sure there is. I'm not an expert on everything, but I would say one of the other bills that's being put forward is, for instance, to compensate doulas that support um, women during pregnancy and childbirth and postpartum. And what we've seen is that when a doula is involved with a pregnant person, that there actually is a lower rate of intervention, which means that then there's a lower rate of morbidity and mortality and ongoing health problems, which in the end, boils down to less money spent
Hmm.
on that individual, whether it's private insurance or Medicaid, right? And I think that that's one of the keys to us like moving this conversation along and doing what works best for everyone to improve outcomes is to know that there is still a cost, right? When people are not receiving optimal health care. And like you mentioned earlier, there's a cost when they are not receiving optimal health care before pregnancy. So having, like you said, access to healthy foods and those kinds of things. And so putting, more money into um, helping people have access to Medicaid and insurance and healthcare across the lifespan is going to be a tide that rises all boats.
Yeah. Is there restrictions on where women can go if they're on Medicaid compared to women if they have private insurance?
Yeah, so if a woman is a recipient of Texas Medicaid, they will go to a provider that accepts Medicaid, and Medicaid reimburses at specific rates. And so each provider will determine if that is um, a choice that they make for their practice. And I can say that there has been, kind of a consistent request of OBGYNs and medical providers to increase the reimbursement rate for them as well, so that it is not as impactful to their bottom line, right?
Hmm.
And we see specifically, like in subspecialties like psychiatry and psychologists, there are sparse, if not in many parts of the state, no psychologists or psychiatrists that take Medicaid. And what we know is that nationally, mental health is actually the number one cause of pregnancy-related death. And in the state of Texas, it's number two. When you boil it down, a large demographic in Texas is the Latinx community, and mental health is the number one cause of pregnancy-related death for the Latinx community. And so being able to pay more to these healthcare providers and mental health care providers would incentivize and enable them to provide services to women who really need it, and in many cases, save lives.
What's the age range of the women that have these birth problems? Is there a certain age and amongst the African American women and the Latinx community?
So a lot of that data is not necessarily broken down. What we do know is that above the age of 35, which is considered to be advanced maternal age, I take offense to it because I had two babies
What is that?
above the age of
What
35.
does that mean? Is like
Um,
it's not ideal to get pregnant over 35?
it's not ideal, but we see that happening more and more, and especially with women who are in the workforce or who have advanced education, they might be delaying starting a family. But we know that having a baby over the age of 30 increases your vulnerability for cervical cancer and breast cancer. We know that above the age of 35, our bodies change, and so the risk goes up. the risk for birth defects, the risk for complications, over 40, it is astronomically high in terms of the risk for morbidity and mortality. So if you take a Black woman like myself, I'm 41, and you take, the statistics of, the likelihood of having a pregnancy-related morbidity and mortality, and then you stack age on top of that, it can be kind of scary. Not kind of, it's scary. And so it's not as dire for the Mexican American community, or the Hispanic community rather, but it is still a concern. And like I said, I am a multi-ethnic background, and so it's not uncommon, especially on my Hispanic side of the family, for women to have babies, well into their 40s. So there are increased risks, and there are more C-sections that happen. And anytime a birthing person has a C-section, then there's a higher risk of complication with that. One interesting thing, though, or 2 points specific to the Hispanic community that I wanted to share, is that when we looked at the poor outcomes in the state of Texas, in like where it's happening, we see that there are higher percentages in urban and rural areas, but we actually see a lower percentage of pregnancy-related complications and deaths in border towns, where there are higher numbers of Hispanic birthing people. And then in addition to that, we now have early data that shows that Hispanic women actually had a really large, disproportionate negative impact in terms of pregnancy-related death and health complications during COVID. And so I think we'll see more come out on that in the next year or so, and have to, ask some tough questions around that piece as well.
Well, one area I know that needs to be improved on is sexual education or sex education in public schools. I think the sex ed in public schools is a freaking joke.
So Texas is we are unique in many ways in how we make decisions and laws and policy. And so I used to actually be a health teacher. And in Texas, that's where sex ed happens, is in health. And I was a high school health teacher. And so I got to teach about reproductive health, the reproductive system within the body. And that's kind of how it is presented. We couldn't necessarily talk about contraception. Texas has, been very much so of the mind of abstinence only. And that is, it is what it is, I guess I should say.
Yeah, it's tough, right? I mean,
but it certainly, I think it's going to be increasingly interesting over the next several years, given the recent laws around reproductive health.
Abstinence clearly not working, right? I mean, it's like it worked maybe back in the golden days or whatever, but kids are getting educated on sex with TikTok now and Instagram Reels. So if, the adults, the community is not educating them, they're getting education elsewhere. I think that's like a big area that needs to be improved on, especially like you said, with recent legislation impacting women's healthcare in Texas specifically. We got to do something else, because teaching abstinence is not, I don't think that's the way to go.
Well, and, to kind of drill that further down, and I really try to steer clear of the landmines of these, very politically charged topics. But what I will say is this, is that even when abortion was not legal before Roe v. Wade, people were still having abortion. So when you talk about the golden age, it just looked like women having procedures from people who were not medical professionals. And there were women who died from that, whether it was a surgical attempt at a surgical procedure or the use of herbs and those kinds of things. And I think that we are going to see an a people are going to try to find solutions, because for some people um, it is a matter of survival, whether it's that they can't take care of a baby, um, that it compromises their mental health, and a confluence of different factors. But it was still happening. And what we also know is that for those who are more affluent and who have access to more resources, they had other means of getting that type of health care.
And Texas is a funny state because during the whole COVID pandemic, a lot of majority politicians, people in the state were like, "My body, my choice," against the vaccine, and then shortly after, just like, "Nope." But we need this law because abortion is wrong. Like you don't have a choice. So it's just a funny state. And like I said, they are political landmines, and it's a tough topic to talk about because it's so nuanced. It's not real black and white. You can't just make simple decisions.
Yeah, and for me, I think that's an excellent point. I think, the thing that's really been sitting with me around that is, if in fact we have, decided that we want to um, protect, life, then we have to make sure that we're, following that canary all the way into the mind, right? And what does it take for that baby to then be healthy and safe, right? And not just during pregnancy, but after birth. And the reality of the situation is those who, are going to be the most impacted are people who probably have the least amount of support and resources. So what does it look like to ensure that those children are physically, mentally, emotionally healthy? They have access to quality education, they have access to early childhood education and healthy food. And so there's so much that's tied to it. So, okay, great. We're going to do that. We're going to say, that, babies' lives matter, but everybody's life matters. And the reality is that some people come to the table further behind.
Mm-hmm.
And equity looks like giving them what they need so that we're all able to have, similar quality of life.
Yeah. Well, Nakeenya, I think that's a great way to end the conversation. I appreciate your time. I think the work you're doing and your organizations that you're involved in are very important. So I'm rooting for y'all, and I can't wait to put this one out and help represent. So it was awesome.
Thank you so much, Jonathan, for smoking me out.
No, absolutely.